Hi, I'm Dr. Josh Vance with Camizo Diagnostics. So today I wanted to kind of explain to you what we're doing with Camizo, why are we utilizing this, and how possibly you could utilize this tool as number one, adding professionalism to your clinical practice, but also how to do the main purpose of this, which is to correlate care with a patient. How to actually give them the understanding of why you're doing what you're doing based upon their symptoms. So here's the thing, is that we want our patients to get well as fast as we can. We want to also the patient to understand why we're doing this, because a patient that understands why they're there, why they're following up with care with you, is going to be committed to that. So we utilize Camizo to bridge that gap as a communication tool between the practitioner and the patient. It puts them both on the same page, literally, by looking at different areas of referral. So it was a painstaking work to be able to put all this information together at once so that you could utilize this in real time. And I'm just going to show you a little bit how I utilize it every day. I use it on nearly every patient, especially when it comes to correlating exercises and stretches. But we definitely use it on every new patient and every re-examination we give in our office. So I'm just going to kind of take a step through and just tell you a little bit about how my staff utilizes the protocols. But also, is that what's really neat with this is this has improved my memory when it comes to muscles, and allowed me to bridge the gap of understanding referral of pain. So when a patient comes in and they're just pointing to an area, and then I hear a little key details, oftentimes it'll immediately correlate exactly what's going on. And that built from just understanding and utilizing this. So it's a good refresher for maybe some docs or practitioners that have been out of school for a while and don't remember exactly what nerve goes to what muscle, all those types of things. And it also helps those docs and practitioners that are new in practice, and so they can actually have confidence in being able to share that with a patient. So what it is that when it comes up in, especially from technology, we accept that. We'll accept something that we see as visual pictures. Okay, that makes sense. And if that correlates with their condition, it's like hitting a home run. And so I'm just going to kind of run through real quick, and I'm going to show you a little bit about how my staff utilizes this when they come in. So on our front page here is where we have our model, is that a patient can come in and they can immediately select the area of where they're hurting. It helps us to kind of define or to transition into exactly the cause. But from a standpoint, a patient says, I hurt and I want to know either why and I want to know what to do with it. So if you have a patient that comes in with specifically neck pain, left or right on the backside, and my staff will actually select the area and then ask the patient just to kind of correlate, does any of these look like your referral patterns of pain, especially in that area? So you're pointing to the pictures that radiate through that region, and then they'll select and say, you know what, I forgot to tell you that it did go into, like for instance, my shoulder here. And so what they do is they will select the picture on there and they'll write that down for me and identify which muscle that the patient actually said looks most likely as a cause or the region of pain. And then from that standpoint is that I will palpate this to find out if that correlates with their symptom referral. And it's my staff, they learn the muscles, and that's what's really pretty cool, to a point where they can even handle questions even more so when it comes to giving exercises and stretching. So my staff does all the teaching of exercises to the patient and correlates to be able to follow up. So it allows me to be able to help more people, but also gives them the same excellence of care just based upon what they see for it. So this is a great example. When I have a patient comes in and their head is shifted to one side and they're essentially similar to a torticollis, but I notice it on an x-ray and I see that their head is deviated to one side, then what happens is I will correlate that with the levator scapulae, because it's usually the one that's tender in that. So I'll go in and palpate on these areas here, these trigger point referrals, and then I'll correlate with the patient. This is the muscle group. And so when the patient understands that I can see their pain on a screen with them, and they go, that's it, that really is my pain, then I can go and explain to them the muscle part of that, but I also can give them specific exercises. And so when I tell my staff, all I have to do is just, I either will mark them with just a little marker on the exact trigger point of this level, and then I can correlate that and send them on to other therapies, whether that's using a percussion device, using ultrasound, even sticking acupuncture needles into this point if you do acupuncture. But the cool part is this, is they understand why I'm doing that therapy, which allows us, number one, is to get the patient better. Instead of having to have a discussion about whether, well, I don't know if I want the therapy. Well, here's the reason why we're doing the therapy. It's right here in front of you. These two dots are the cause. This is the muscle. And so I want to make sure that that frees up the muscle as much as to give you as best a relief as I can today. And then here's your homework to do at home, and I'll send those, and you can actually do them via email. And I'm always about educating patients. Patients that today when they walk in, they want to know more information. And believe it or not, they're getting online anyways, and they're consulting Dr. Google to find out what their condition is. So here's the cool part. This information is right here on your desktop, and that's what I utilize it alongside of my EHR. I put it up there, and I just pull up this because it's web-based. All you got to do is show them the picture, and then I just watch the little lights. The little lights come on. The patient gets the big picture, and they're like, man, I do spend a lot of time on my phone, especially with this one with the levator scapulae. It stretches that. Or I sit in front of a computer all day. So we correlate the reason real time with it and give them specific things to do, and also why we're doing the care that we're doing. So this is just the basics of how to utilize the regions part of this, but also how to utilize your staff. So engage your staff with it. They love to learn. My girls that work with me, they're constantly learning, especially when it comes to conditions, almost to a point where they're thinking ahead of me, and that helps us in our busy practice. So I hope you found value in this, and have a great day.